see your name is Todd Blackberry. Okay. Alright, so how are you doing today, Todd? It's good to see you. Good to see you. So make yourself comfortable. I am just gonna ask you some preliminary questions, okay? And just since I've never seen you before, we're gonna have just a consultation just to get you checked out and see if we can get you feeling better. Okay, so what brings you in today? I know I looked at your file, you said some stomach problems. Okay, so you've been having... Okay, so some severe stomach pain. I am so sorry to hear that. So I'd like to ask some questions about that and just some questions about your medical history as a whole, okay? So, can you verify your date of birth? Okay, great. Okay, so first I want to ask if you have any history of stomach problems. Is this something that has happened before to you, or is it quite new? Okay, quite new. Okay, and when did the pain start for you? A week ago? Great. Okay. Well, not great, but great that you're being specific. So what would you describe it as? Is it a sharp pain? Like a queasiness? Okay. So a queasiness. And how's your appetite? Decreased appetite, that's to be expected. Okay, so like a queasiness, would you say it's akin to nausea? It is nausea with a sharp shooting pain. Okay, great. So what have you been doing to treat this? Okay, so Tums, it's good and it works for certain nauseas and indigestions, but it sounds like what you're dealing with might be more neurological. I know that stress can bring on a lot of stomach issues, so are you going through a lot more stress or more stress than normal lately? I would say yes. Okay. Because of the upcoming elections? Okay. And you also, okay, so you want to travel to space, but you don't have enough funding to be an astronaut, and you feel as if your days are numbered and you'll never be able to fly off into the Earth's orbit and view the world from the cosmos like William Shatner. Well, just a second to write that down. William Shatner. Okay. Alright, so this is a very specific form of stress. Wanting to go to space is a condition that can occur, but it is more of a rare type of stress, but it's documented, absolutely. So you are not the only one that is dealing with this form of stress, and I would say that it's definitely contributing to the symptoms that you're feeling now. So when did you first learn about William Shatner's trip to space? Okay, so you saw it, oh wow, you're late to the party. This was several months ago. Okay, and that just, it made you anxious, right? Because he enjoyed it so much, and you are not a fan of William Shatner. And you are not even before his space travels, but now that he just fulfilled your lifelong dream, you have even more animosity towards him, and that is definitely understandable. Wow, that's a lot. So I think today we're going to do a combination therapy session, and we're going to do a holistic checkup. I want to check you head to toe, and I want to ask you some questions about your very complicated, nuanced, I won't call it an obsession, but a preoccupation with William Shatner and his experience in space. Absolutely. Okay. Okay. So I want to set first, on a scale of 1 to 10, how would you rate your pain? You would rate it at about a 7. Okay, that's pretty bad. That's pretty bad. No one wants to be going through a pain up to 7. Does this get worse at night when you sleep, or in the morning, or is there a certain time? Okay, so just when you think about William Shatner, and especially his trip to space. Okay, fair enough. Fair enough. So I think we've identified the root cause of the problem. And I'm sorry this is causing nausea for you. So just a few questions just to make sure that we're nipping everything in the bud. Do you have any history of pulmonary disease or hypertension, high blood pressure? Okay, so just a little high blood pressure. Are you taking any medications for that? Not at the moment? Okay, that's good. Okay, so what we want you to do then is to, maybe we can attack this dietary in a dietary form. So when you leave today, I'll give you a little sheet about things you can eat that might bring down your blood pressure naturally. So we can focus on the source of the problem. And actually, I think once we talk about what's bothering you and kind of iron that out, smooth things over in your mind, some of that blood pressure will just naturally decrease. Okay. All right. Are you a fan of Star Trek? You never were. Okay. Okay. This is all fair. So, do you have any history of stroke? Okay, edema? Just any baseline depression or baseline anxiety? A little anxiety. Have you ever taken any medication for this? Okay, so no. Interesting. I think you might be a good candidate for some anti-anxiety meds. Because I've noticed so far in this interview, every time I've said the phrase William Shatner, you've done a little twitch, like your whole body is twitched. Almost like I just poked you with a electrical wand. So that's not something that we want to have a condition, because whether you like it or not, William Shatner's around. He's out there, okay? He's slowing down now. But you're not really going to get through probably a month without hearing his name at least once, so we got to deal with this. Okay, absolutely. So how's your stomach pain now? It's increased because I've said William Shatner. William Shatner. William Shatner. Okay. Yikes. So right now what I'm doing is an attempt at exposure therapy. So during this assessment, I'm going to be saying William Shatner quite a lot. And this will just be something that we're trying. If it ever gets to be too much to where your pain is at a 10, we can stop. So I've asked you pretty much the basic general questions. And now I just want to do a full body exam. And we're going to pay extra attention to your stomach. And I'll be feeling for things in your stomach. And we might even be doing an x-ray. And we might be doing an MRI. But if it's what I think it is, this is more psychological, okay? Okay. Well, you're doing great so far. You are such a trooper. And I'm going to wash my hands, put on some gloves, and I'll meet you in the other room, okay? Okay. I'm just going to start with your head, okay? So if you may move closer. Okay, good. All right, I just want to feel your head right now and make sure that we're not dealing with any kind of concussion, okay? Okay, very good. All right. It's okay. It's okay. Just relax. All right, I'm going to do a very thorough palpation because I just want to make sure, I want to be very sure. Because actually the last time that we had a William Shatner anxiety spiral negativity case was, it was the result of a concussion, actually. Yes, it was a woman who fell out of, I think it was the back of a truck, and she hit her head, and she ever, like, for the weeks following, she couldn't stop talking about, what a bad dude William Shatner was and how he's so annoying and all that. And I just really want to make sure. I know you said you didn't have any accidents and you have felt this way for quite a while. Just bear with me, okay? Take a deep breath. Deep breath. Good job. You're doing so good. Good job. So far, I'm seeing that there's nothing clearly wrong with your head. I didn't feel any lumps or bumps, no scarring. Your face was perfectly symmetric, so that's very good. And so we're just going to do some percussions, just to make sure that I'm hearing the right reverberations. Okay, very good. Okay, that's normal. Okay, had a little glitch there. Nothing to be worried about. Okay, and if you don't mind, I'm going to take my jacket. If you don't think I'm being fresh with you, it really is just very hot in this room. So, relax. Okay. Fantastic. That's very good. Alright, so no signs of a concussion so far. So that's very interesting. I'm relieved, but we're going to get more to the root of the problem, okay? So I'm just going to come forward and turn around. So I'm just going to look at your head. I'm just going to check for lice. Any lice, or especially ticks, because there are known ticks in the forest that can get in your head, and what they do is they kind of take hold of your brain and kind of change around the cells to make you obsessed with certain media figures and actors. So, okay. So I don't see any media ticks. Okay, I see one big tick here. Ooh, hope that's not a deer tick. We know it's not a media tick because it doesn't have a white stripe in the middle, and those are the ones you need to worry about. So it is not a tick that is causing your bitterness toward William Shatner. Okay, but that was a big tick. It was engorged, absolutely. Okay. Alright, looking through, peeling through your head. Oh, you have a beautiful head. See a nice little bald spot on top. Does that run in your family? Okay. Alright. Okay. Alright, so turn around and look at, so right now I want to say, this is just off the record, but you have nothing to be jealous of with William Shatner in terms of appearance. While I was applying my gloves and sanitizing my hands in the other room, I did a thorough analysis. I looked up a picture of him on my phone. His face is not symmetric. His skin is not well perfused. He is not pink and moist in the tongue. And he is running a fever most times. I could tell by looking at him. He has a little rosacea about him that tells me that he is running a fever. His blood pressure is very high. And, you know, he has a hard time getting around. So I know that a lot of your bitterness towards him relates to outer space, but you shouldn't be concerned with appearance because you're actually quite handsome. Okay, so I'm just gonna brush your nose a little bit. There you go. Calm down. You're quite handsome. Yes, you are. Okay, good. So look at me now. So I can see generally your face is symmetric. Let's take a measurement, okay? So I see from a distance you do look like you have a very nice head shape. Can I come a little closer? Alright, now I'm just going to measure the inches of your head because that's important information when it comes to stomach problems. Yes, you wouldn't think so, but it is. So just hold still, hold still, hold still. You're doing so good. Okay, so you are at 22 inches, quite a large head, but that's okay because I see the measurements on the high end of normal. So do with that what you will. And I want to make sure that it's equally on both sides from the center, that the inches are the same, because that also is very important in terms of stomach aches, okay? One more time. Stay still, one more. Alright, everything measures up, so you've passed the head check. So I want to do some quick testing of just your nose and of your eyes and your eyebrows, okay? So I'm going to put my fingers right above your eyebrows, and I want you to try to raise them. And I'm going to stop you. I'm going to try to apply pressure down. Don't let me do that. We're looking right now to see the strength of your nerves, to see, you know, if you're at any risk for a stroke. So here, right there on your, try to raise your eyebrows. You look funny when you do that. So try to raise your eyebrows. Yeah, you look funny when you do that. Okay, ooh, very good resisting, so that's good. So right now I want you to, I'm going to reach forward and I'm going to touch one side of your nostril. Okay, and I'm going to be touching this bone right here in your skeleton. And I want you to try to move your face toward my hand. Okay, and I'm going to resist. I know it's going to feel a little funny, but it's worth it. So 3, 2, 1, resist. Good job. Okay, let's do it again on the other side. And 3, 2, 1, resist. Okay, good job. So what about smelling? Let's check your smell. So I have a few separate smells for you. A couple just serums and aromas and bottles, and a couple cosmetic smells, okay? So first, this is a general one, and this should be really easy. What is it? What does it smell like? Coffee. Good job. Good job. That's wonderful. And so next, I want you to smell this. This is a strongly flavored lipstick, and I want you to tell me what it smells like. We do this because it's easy to put, you know, a carefully constructed aroma in your nose, but the more subtle hints, like what you're going to smell in this lipstick, is important because it tells you about your the acuity of your sense of smell. So just smell. Berry. Good. What kind of berry? Cherry. No, it was strawberry, but that's very close. I'm going to go ahead and make a note that you almost got that, but you didn't quite. So, thought it was cherry, was actually strawberry. Okay, so, but we still have a couple. One more actually. Just one more. And this is going to be an important one. See, there's a little substance in here, and I am going to just perfuse here. Make sure that the smell is wafting up. And what do you smell? No, it's not the tears of William Shatner. No, sorry. Yeah. Okay, I don't know what to tell you. These are not the tears of William Shatner. It's pineapple. Okay, so that's a problem. I feel so far as if your symptoms are definitely psychosomatic, and that, you know, the things that you smell, hear, and even see might be influenced with light hallucinations that have to do with your William Shatner thing that you got going on. So, you know, and we want you to be able to smell something that smells like it is. So I'm just going to write that down to talk about in our therapy session. Okay, but you got the first one right, second one almost right. So you definitely have potential. You're not losing your sense of smell. It's just redirected because of the things going on in your head. So next, I like to do an impromptu vision test, and This is just going to be about your field of vision and your movement. Okay, my nose. Try to keep your attention on my nose. I'm going to be making some curious, perhaps strange little hand movements in the background, but I'm testing your focus. Just keep looking at my nose, okay? No, on my nose. Keep it on my nose. Good, okay. Okay. Okay, good. Okay. So your focus is relatively good. I want you to keep looking at my nose, and I'm going to be moving my fingers. I want you to tell me if I'm moving my right or my left, okay? That's my right, good job. That's my right, good job. That's my left, good job. Right, good job. Right. Good job, they're both. Okay, right. No, that was left. You almost tricked me. That was left, so let's do that again. That was my left, yes. My right, good. That was my left, good job. Okay, so that looks good. I want you to tell me when my fingers exit your field of vision, okay? Okay, good. Okay, good. Okay, good. Okay, good. Cranially, you're doing fantastic. I want you to read a few words for me just to make sure your reading is good. We're going to move on to vitals and then take a look at that stomach, okay? Okay, so this is a piece of paper with a bunch of numbers and they're listed inside of squares. I want you to tell me what this number is. That's 13, correct? What about this little thing? What does this say? What does it say? Can you read it? Pro, good job, good job. What is your vision? You have 20/20 vision. Do you wear glasses or contacts? Wow, that is very impressive for someone your age. I hear William Shatner is very hard of sight. So that's another reason to, see I'm drawing you out of this idea you have of William Shatner as being a threat to you. So what is this number here? That's 35. Excellent. What is this number here? What is this number here? That's 33. What about this number here? What about this number here? 376. What about this number here, the little one? 376. That's fantastic. So your vision is good. We've ruled anything going on here that could be contributing to your stomach ache and obsessions. So real quick, I'm just going to take a couple vitals. You seem really good since you just recently had a checkup at the other office. We got your files, so I won't have to do an extensive checkup, but just want to make sure you're breathing properly, especially today. Okay, so it's important right now that you just really relax, because you deserve to. Okay, so I'm just going to feel your heart. Deep breath in. Deep breath out. Good job. Deep breath in. Stay with me. Deep breath out. Deep breath in. Deep breath out. You're relaxing so well. Good job. I'm just sending you some love right now because I can tell you need it. I'm a bit of a hippie doctor. I'm sending you some love. Some calm and relaxing love. Okay. Good job. Okay. So you're really starting to breathe more rhythmically and normally. That's so good. Okay, so I want you to breathe in for me again. Your heart's great, by the way. What about your lungs? Breathe in and breathe out. Breathe in through the nose and breathe out. Very good. Are you feeling sleepy? That's a good sign that you're feeling sleepy, okay? Breathe in and breathe out. Breathe in and breathe out. Fantastic. Let's get your back, okay? Okay, so if you could turn around for me. Thank you. So same thing. Breathe in for me. And then breathe out. Breathe in for me. And breathe out. Breathe in. And breathe out. That's so good. So your lungs sound good. Your back sounds great. Your heart sounds normal. I didn't hear anything that would indicate a heart murmur. However, I did hear a little murmur saying, it was a curse word. It was blank William Shatner, blank William Shatner. I don't want to repeat it to you because this is a PG doctor's office. So, but it's a little concerning to use that strong of language against a man that probably doesn't know you. Yes. I don't have time to talk about the unexplained right now. I know it's a hit show. Yes, I know he's producing it. Okay, let's move on. Let's take your heart rate, okay? Let's take your pulse. Okay. Give me your wrists. Yes, very good. Okay. So that's 82 beats per minute. Okay, so so I'm writing that down as 82 BPM. Alright, and next we'll do your temperature and then we'll move on to your abdomen. Okay, so this is more of an old school thermometer if you don't mind. It works just as well. So can you stick out your tongue for me? Good. Good job. Hold it. Okay, you're doing great. No, don't think about him. Don't think about him. Think about me. Look at me. Okay. Okay, that is 98.6, textbook perfect. Good job. Okay, so you're doing really well internally. Let's feel that stomach of yours, alright? Alright, so how are you doing? Very good. So I want you first, before I do anything, take a few deep breaths in and out. In through the nose, out through the mouth, like we did when you were standing up. Alright, I want to start at a base relaxation line. And I'm just going to feel slowly palpating. Okay, good job. Very good. Just trying to feel for certain things that might indicate that you have any kind of enlarged organs that might be causing this. But your organs feel very good. Yeah, I don't see any organ problems. That's fantastic. Alright. So I'm going to do some quick massaging in your stomach area. Okay, because I can tell that you're still very tense there. And you're doing your best work to breathe. And I'm really glad that you're doing that. But I'm just going to do some rubbing to simulate the process. Okay. Good job. Good job. Good job. He's sleeping. Oh, good, he's sleeping. Deep breaths. Okay. Your stomach feels beautiful. Yes, and you're very toned, you know. William Shatner, you know, God bless him, but I don't think he's as toned as you are. You need to believe in yourself more, okay? You have a lot of good qualities for yourself. And just because you're not William Shatner doesn't mean that you don't have a lot of good things going for you. And who knows, you might win the lottery and make it to space one day. It could happen to you. Okay, now I'm going to listen to your stomach, okay? Just keep breathing deeply for me. Good job. In and out. Good job. In and out. Good job. In and out. Great. One more. In and out. Good job. Great. Now I'm going to apply a little bit of lotion just to smooth out the area, and this has a lot of good qualities that just soothes the stomach. job. I can see you're really relaxing now. That's so wonderful. Okay. All right. You're feeling better in your stomach. That's so good. Okay. So, I'm gonna let you on your own time get up, and we're gonna have a brief consultation, okay? And then we're gonna be finished for the day. Okay. Great. So, how do you feel right now, Todd? A lot better? Oh, that's so great to hear. So on a scale of 1 to 10 now, at this point, what would you rate your stomach pain? About a 3. That's an improvement. It was a 7, now it's a 3. So we're getting there, and what I suspect is my positive affirmations throughout our session really helped you with your anxiety and preoccupation with Mr. William Shatner. And you know what? I'm going to start you on a workbook regimen, okay? I think we're going to work through this with daily writing exercises. I'm going to make one, customize it for you. I'll give it to you on Wednesday. I'll print it. What time do you have on Wednesday? Okay, 3 p.m. Okay, so the workbook is just going to be a lot of self-discovery, self-reflection, and I think that's going to be really important to gain your self-confidence and know that it's not too late for you to go to space. Anything could happen in terms of, getting the funding, or perhaps space travel being much more economical in the future of the cost of a flight to space. A flight around the Earth in 5 years might be like buying plane tickets. We don't know where the future's going, so I would hold out hope, and I would just focus on that goal instead of the negativity. So instead of focusing on not liking William Shatner, focus on your love for space, okay? And that's a general direction we want to point you towards, but we're going to do that with exercises. So the first one is, I want you to go home and list 20 things that you like about yourself that you think you do really well, okay? None of them can be in relation to William Shatner. I don't want to see him. I don't want to see that name on that page. So that is your Monday assignment. So that's tomorrow. So I want you to write those things down, and tomorrow and Tuesday, I want you to not say his name. Don't say his name. You can think him. Okay, you can't control your thoughts all the time, but don't speak him out loud in your house. Alright? Because you have to free yourself of his clutches, and that all starts with action. We don't always believe in ourselves. We don't always believe something, but if we act as if we believe, that's the first step to achieving what we want. And I know you want a more relaxed life, and you want your stomach to stop hurting, so I'm going to give you some of that ointment that we had today, and call for a follow-up, but we'll definitely see you on Wednesday. And I think that you have a bright future, okay? I see you as a beam of light, a beam of love, a soul on this earth that exists independently of an actor from Star Trek. I mean, really, it's so wonderful that that's the truth. Okay, so there's what's in your head and the truth, and that's the truth. So I think we're going to get along. So I'll see you Wednesday. Thank you so much for coming. All right, and we'll see you then, okay? All right.